We've had very substantial increase in active treatment for our patients so that they get active assistance. The reason we have succeeded on this is a combination of additional hiring, where we've succeeded in adding 388 net new staff members at Western State Hospital in the last several months. Talking to the staff and the nursing staff, this has allowed them to substantially improve the safety of both the patients and the people who work here. I just talked to one nurse who said, you can't believe the difference when you have to have a ward when it's just you alone and no one watches your back, and having 2 nurses. We have been able to now staff these wards with 2 nurses to substantially improve safety and allow active treatment options to improve patient performance here. I heard a very encouraging story of innovation. And one of the things we're good at in Washington is innovation. We're good in innovation in software, we're good in innovation in aerospace, and we've been good in innovation here at Western State, where under Cheryl's leadership, we have a whole new onboarding system of bringing new employees and providing training systems with them. I saw the building that's been newly dedicated to that purpose. And as a result of that, we've been able to not only have innovation in how we bring new employees here, but how patients leave. I talked to the new director of discharge planning. She told me of a really compelling story of a man who'd been here for it was either 16 or 18 years, who was blind and very severe disabilities. And because of the innovation that they've been able to bring, they were able to find him a placement after 16 years to move into a more community-oriented facility. That's the kind of innovation we want to see. So we know this has been a very challenged institution. We've had challenging times, but it is a place that has made very substantial improvement in the last several months. I don't know whether to call this halftime of the third quarter. This game is not over. This job is not done. This hospital still needs continued improvement, but we have the direction, and I hope we're going to have the resources from the legislature to continue this. Now, I must tell you, with all the great news I see at Western State Hospital, I have great concerns about what's happening in the Capitol, because at least one of the budgets would essentially zero out and eliminate the resources that have been so successful here in making this improvement. We have 388 more people providing critical care for these patients for several reasons, but one of which is we've been able to provide them compensation to make this as an attractive place to work. And when I talked to the staff, they all told me the same thing. We can't let the pay increases that have allowed this place to be competitive to collapse. We will again go backwards and not have the people to do the job. So I'm very hopeful, and I'm going to take the stories I've heard at Western to legislators to say we have to continue this progress at Western State. We're still about 60 or 65 employees short, and we've got to have a compensation plan that will allow people to continue to work here. There are several shortages. Our shortage of psychiatrists still remains a daunting challenge for us, and we still have to improve that compensation to increase our competitive position. So long and the short of it, a lot of good news here at Western. We still have a climb to do, and we need the legislature to help. And now I'm going to introduce Cheryl, who's brought, her leadership has really been stellar. The morale here at this is night and day since we started this program months ago. And her leadership has been critical to that success. Cheryl.
Thank you, sir. Thank you, Governor, and thank you to the press always for being here. This has been an incredible journey and continues to be one of great compassion and restoration. We here at Western are doing everything that we can within our power to make the improvements being asked of us. And we thank the Governor for his heartfelt support and commitment to these patients and families. We are working very closely with our labor partners and our community mental health partners to get our most vulnerable citizens well and back home to the communities where they belong. We have made thousands of improvements in patient care, staff and patient safety, and our physical plant within a very short period of time, the details of which are in your press packets. This is a process of many hands putting together hundreds of puzzle pieces to care for Western's 857 patients. These improvements make a very big difference in the lives of our patients, which also make it possible for many to be discharged. And as you heard from the governor, some of whom have been here 15 years and more. This is, though, just the beginning. Maintaining and sustaining these improvements have to become the new normal. Western State Hospital is part of a larger safety net within the Department of Social and Health Services, and as a team, we have been able to make improvements that benefit our patients, our staff, and our community. And I am one of many honored people who get to be a part of this amazing transformation. So thank you.
You're going to introduce another speaker?
I am going to
Cheryl?
introduce, I'm happy to, this is Barb Sheldman. Barb Sheldman is a nurse and a labor leader with the Service Employee International Union 1199 and a great partner.
Thank you, Cheryl. Good morning. My name is Barbara Shellman. I am a nurse here at Western State. I work on the Center for Forensic Services, coordinating admissions from the courts, the jails, the community to admit people from the jails and from the community. I've been here 10 years. I'm the chair and an executive board member for 1199 Northwest, supporting and representing the registered nurses here at the hospital. On their behalf, I'd just like to say we are honored. We are deeply committed to providing the best care to our patients, to the communities in Washington State, families, the state of Washington. We've had some serious challenges that the governor and Cheryl have talked about. But over the last year, with the addition of incredible work at adding all these staff and 51 new RN positions, has made an incredible difference for the staff and the patients working these wards in the hospital. The safety and the care that we're able to provide with adequate registered nurse staffing is very heartening, and it's allowed us to recruit nursing staff, registered nurses that we have not been able to in the past. We've not been able to for a long time. So we are very heartened, we are very hopeful that these improvements will continue for our patients and for the staff here at the hospital. We will continue to advocate for our patients with the legislature under the governor's leadership and the Democratic House budget recommendations. We feel that funding of the collective bargaining agreements will continue to help us move to a better system in Washington State for our most vulnerable. Thank you. And I guess.
Hello. Hi. My name is Mike Yastrzemski. I'm a social worker here at Western. I've been here approximately 5 years, worked with admissions, long-term, worked with some forensic patients, and so I just wanted to thank everyone for being here. Thank the governor for coming, and basically just address that our targeted recruitment, our COLAs have gone a long way in improving our department as a whole, social work, the hospital as a whole. Prior to this coming in, we were bleeding staff. We couldn't keep social workers. People would come and leave. We couldn't hire. Social work is one of the job classes that was specifically mentioned in a CMS report as being understaffed. And since then, with the changes that the governor and Cheryl Strange have made, we've been able to hire a large number of staff. We've been able to get people with licensure and more qualifications and more experience. So not just more people, but better qualified people into the hospital. And without that, I think that we would, as has been mentioned, go backwards. We would lose a lot of those people who would go into other places that would pay more. As we know, this is an expensive area to live, so people need that. It's been helpful, again, to our clients also to have the consistency of staff, having the same staff that work with people that know the patients, are able to really get to know them and build that rapport and build that trust. It's been very important. And then, again, there's been a lot of problems that we've faced, but we've improved. It's been amazing the improvements that we made, and it would be a shame to allow us to go backwards. And we can't let that happen. So I know myself, And my colleagues all, plan on continuing to get that message out, that it's, for the community, for our clients, for everyone, that we must have the competitive wages, and part of that is funding the contract that is in front of, the legislature right now. There are a lot of challenges in front of us, but we want the hospital to be an employer of choice. We want the state to be an employer of choice, and this is a big part of making that happen. And once again, I just want to thank the governor and thank Cheryl for all the work that they've done, and thank you guys for coming.
Thank you. I'll make a couple of comments, stand for questions listening. You may have heard this before. The inadequacy of staffing profoundly jeopardized patients at Western State. And the principal reason for that is that we could not hire people at this institution. There were 25% gaps between what this institution was paying and what people could make just working down the road at other hospitals. We fixed that. And because we fixed that, we are now providing quality care at Western State Hospital. If the legislature does not continue to allow us to fix that problem, this institution is going to collapse again. That is totally unacceptable to the state of Washington. It's unacceptable to the U.S. Constitution, and it's unacceptable for our hearts to care for these people, because they get better at this institution. They leave this institution, they go back to their families, they go back to their churches and their places of employment. This place can really help people as long as we have staff to do the work. One other thing I want to say is the solution to our problems at Western State are not all found on these grounds. The solution is to have a diversion program to keep people out of the legal system so they don't end up on a forensic ward. And we have communities across the state working on that. I've seen that in Everett, I've seen it in Spokane. It's part of our budgets. There's some good news. Both parties have shown some interest in increasing the diversion programs to keep people out of Western State Hospital. We also have to have more community placement for people leaving the hospital. Today there's, 50 or 100 people today ready to discharge from the hospital, but there's nowhere for them to go, so they can't be discharged. Again, both parties have shown some interest in improving those community facilities, but we need to be robust and healthy in that regard. So with that, I'll stand for your easy questions.
This visit designed to send a message to Senate Republicans.
I'm sorry?
Is this message that you're sending here designed to reach Senate Republicans to, you say the place will collapse if their budget goes through, and you have to rescind the contract?
Well, look, it's just the truth. The truth can be very powerful, and the truth is that we are making real progress for the people of this state, the least amongst us, our family members with mental illness. That is going to go right backwards, and this place is going to be back in the soup. Not just through litigation, but not able to provide for people. So it's the simple truth, and I hope legislators will hear it. We ran an experiment, what happens when you try to run a hospital on the cheap and fail to pay people competitive wages. It collapses, it fails, it ends up under court orders and decisions by the federal government. That is not acceptable to our state. So we're not going to go backwards. I hope they'll hear that message.
Ms. Strange.